Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. Welcome to online webinar series organized by Faculty of Pharmacy Universitas Erlangga. My name is Elida Zairina and I will be moderating this webinar session. Today's webinar will cover a topic about evolving the role of pharmacists in the healthcare system to achieve sustainable development goals. This webinar is also part of the events to celebrate the 59th anniversary of Faculty of Pharmacy Universitas Erlangga. Before we begin, I would like to give you some housekeeping notes. So all participants are asked to fill in the attendance list at the following link that has been shared by the admin in the chat box. And if you have any questions, please write it with the format name _ us _ speaker's name _ the questions. And we will hold the questions at the end of the sessions. You can see the following example on the screen. So ladies and gentlemen, I would like to read our agenda today. So we will listen the national anthem, Indonesia Raya, continue with the hymn of Universitas Erlangga. And then this webinar will be opened by the Vice Dean of Faculty of Pharmacy Universitas Erlangga. We will have our remarkable speakers today. With the first speaker is Dr. Zaswia Muhammad Nur. The second speaker is Mr. Muhammad Samir Muhammad Sukeri. And the third speaker, previously we have Dr. Siba Rani Naka David, but due to unforeseen circumstances, Dr. Siba is apology, cannot attend and join with us today. So then we will have the question and answer, and also the discussion at the end after all of the presenters deliver the presentations, and then we have closing remarks. Ladies and gentlemen, please join with us to listen to the national anthem of Indonesia Raya. Indonesia Raya. Hymne Erlangga.
Oh
Ladies and gentlemen, now we are moving out to the next agenda. Opening speech by Vice Dean Research Innovation, Community Development and Partnership of Faculty of Pharmacy, Universitas Airlangga, Professor Apoteker Dewi Melani Haryadi, MPhil PhD. We would like to invite Prof. Dewi. Prof. Dewi.
Thank you, Dr. Elida. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Dear our distinguished speakers from Brunei Darussalam, from Malaysia, and all participants from several countries, Malaysia, India, Brunei Darussalam, and Indonesia. Greetings and warm regards from our Dean, Professor Junaidi Khotib, who would like to apologize, cannot attend this morning due to other agenda. Welcome to all speakers and participants in Surabaya to our webinar of the Sustainable Development Goals, SDGs. This is a webinar series of the Faculty of Pharmacy, and this time with the title, Evolving the Role of Pharmacists in Healthcare System to Achieve Sustainable Development Goals. This webinar is a part of our 59th years of faculty's anniversary in 2020 with the big theme, Creating Innovation, Gaining Recognition, Achieving Smart University Values. The 59 is the mature age in the development of institution. This is a very good momentum to re-strengthen the organizations, improve impactful performance, focus on excellence and innovation, expand networking, and gain more advantages of pharmaceutical technology to achieve the Airlangga Smart University value. This achievement will be able to boost the academic reputation, graduates' employability, and all the recognition. Therefore, we would like to again thank you to our keynote speakers in this SDGs webinar. And we hope we can continue this engagement to strengthen our ongoing collaboration to achieve together these SDGs main goals, especially in the SDGs 3, good health and well-being. Sharing strategy in this partnership is the best way to solve some global issues. And we hope with the 17 aspects of SDGs, such as education, good health and well-being, industry and innovation, and also partnerships for the goals and others. Also, we would like to extend our appreciation to the committee for the efforts and making this a successful event. Finally, we wish many potential collaborations for the upcoming partnership between Universitas Airlangga and other university, our valuable partners in the world, can achieve these SDGs together, and we can create more positive impacts on local, national, and global. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for the opening remarks, Prof. Dewi. Ladies and gentlemen, the webinar, Evolving the Role of Pharmacists in the Healthcare System to Achieve Sustainable Development Goals, is formally open. Before we hear the presentation from our speakers, please join with us to do the photo sessions. For participants, we encourage you to open your camera so we can take a photo sessions together. We have 5 slides here and waiting for the admin to have the screenshot, and yeah. Okay, we can see that all participants now open their cameras. Zoom. Okay. the second slide. Third slide. Fourth slide. Fifth slide. All right. Okay, so all complete. All right. Thank you so much, ladies and gentlemen. So now we are moving to our next agenda. Before that, there's just a few reminders that if you like to have electronic certificates of participations, and participants need to attend this webinar session, you can join with us through the Zoom link or YouTube. And participants need to fill out the attendance list that has been shared by admin in the chat box. And then at the end of the webinar or in the session, participants need to fill out the evaluation form. We will share at the end of the webinar. If you have any questions, feel free to address it in whether in Indonesian language or in English language, whether you are joined from Zoom or YouTube, with the following format. Okay, ladies and gentlemen, now we are moving to our next agenda. We would like to invite our first speakers, Dr. Zaswiza Muhammad Nur. We're just going to say hi to Dr. Zaswiza. Hi, Dr. Zaswiza, how are you? I think, yeah, it's all good now. How are you, Dr. Zaswiza?
Hi.
Is good today?
Yeah, it's good.
Okay. All right. Ladies and gentlemen, before Dr. Zaswiza deliver her presentations, I would like to read her CV. So Dr. Zaswiza graduated from University Science Malaysia as a Bachelor of Pharmacy, and she has a Master in Pharmaceutical Sciences in International Islamic University Malaysia, and she finished her Doctor of Philosophy in Pharmacy at University of Queensland, Australia. Her current position is Associate Professor at Faculty of Pharmacy and Health Sciences, University Kuala Lumpur Royal College of Medicine, Perak, Malaysia. She is also Head of Clinical Pharmacy and Pharmacy Practice, Faculty of Pharmacy and Health Sciences at University of Kuala Lumpur Royal College of Medicine, Perak, Malaysia. Her research interest is in the area of community pharmacy, pharmacy services, health technology, and also mental health issue. Ladies and gentlemen, without further ado, Dr. Zaswiza will deliver her presentations about the evolution in the practice, the Malaysian pharmacist experiences, in approximately around 20 to 30 minutes. Dr. Zaswiza?
Thank you.
Are you ready? Yep. All right.
Yeah.
Thank you.
So let me share the screen first, right?
Okay. Yeah.
Okay. So you can see my screen right now, right?
Yep. Yep.
Okay. First of all, Assalamualaikum and a very good morning to all present today. And of course, the first thing I would like to thank to the committee of this webinar for inviting me to share some experiences related to the pharmacist roles in relation to Sustainable Development Goals, SDG. So basically, this presentation is more like sharing experience of what we currently are doing to evolve our roles as pharmacists in Malaysia. But because we think that this evolution is indeed important to ensure that we support the SDGs, as well as to ensure the sustainability of the profession as well. And just a quick introduction, by profession, actually I'm a lecturer and associate professor at university, and also a registered pharmacist in Malaysia. Okay, just a quick introduction of the Sustainable Development Goals. So this is actually introduced by the United Nations. So SDGs are the blueprint to achieve a better and more sustainable future for all. And they address the global challenges that we face, which is including poverty, inequality, climate change, environmental degradation, peace, and justice. It's just that we as a healthcare provider, and to be specific, pharmacists, so how this actually related to us as pharmacists, okay? So according to the United Nations SDGs, there are actually 17 goals. What we are going to discuss today, to be specific, is on the goal 3, which is on the good health and well-being. And as we all know, as pharmacists, health and well-being of the community are our responsibility. And as pharmacists, so we should evolve. We cannot stay at the status quo. So we should evolve to ensure that we support the SDGs. And at the same time, we also need to think of ways to help operation to sustain as well. And this is need to be done in many ways, can be done in many ways. But what I'm going to focus today is only about two things, or the things that we are doing currently. Okay. Just a quick information on the FIP development goals. So they introduced the Sustainability RX, which was launched in 2021 as the FIP's new program of work that supports the progress and implementation of the FIP Development Goal 21. And this is actually for the sustainability in pharmacy. So we in Malaysia, of course, we take note of these three key areas. But what I'm going to share today is focusing on two things, which is responding to disaster and pandemics. And currently, we all know that we actually having a pandemic COVID-19. And also, second one is on the sustainable services. So instead of staying in the having a standard practice, the conventional practice as a pharmacist, we need to evolve and provide or introduce new services, for example. So what I'm going to say next is, before that, okay, on the pharmacy profession. Sorry, it doesn't move to the next slide. Okay, sorry. Okay, we know that pharmacy profession has evolved from the conventional and traditional drug, where last time we focused on the basics, we focus on the drug. So we actually have evolved from the conventional and the traditional drug focus basis to an advanced patient focus currently. It's more on the patient focus instead of drug focus. So in the past century, the pharmacists were more involved in the compounding. Last time, I remember when I was a pharmacist, more than 15 years ago, before I became a lecturer. So we were more involved in compounding and manufacturing of medicines, but actually now the role has significantly reduced over the time. So what we think that what pharmacists need are not only knowledge and skills to dispense at the moment, or manufacturing medicines or other traditional roles. That is, of course, our key roles. But for now, pharmacists should also have additional skills where we can provide value-added services to the patient. So in order to do this, what the pharmacists need are trainings. So what I'm going to share today is somehow trainings and also advanced services that we currently doing in Malaysia. Although this is not involve all pharmacists in Malaysia, but initiatives, the initiative that was introduced I think like last year is currently ongoing. So the key to the successful pharmacy profession in the future is to focus on the specialized knowledge and training of pharmacists. I think that this is very important. So okay, this is an article by Gebhardt. The title of the article is Going Beyond Dispensing, the Future of Pharmacist Roles. So what I'm interested in, there's one paragraph in the article saying that pharmacists might still be responsible for dispensing, but they won't be counting by files and maybe not looking at the vials. Automation, robots, software can probably do the job faster and more accurately when it comes to dispensing. So pharmacists will be adding value and improving health outcomes in other ways. So this is very true. As we can see that we are exposing to big data, AI, all those things, and health technology. So pharmacists need to evolve to catch up with this technology. Okay, what I'm going to share today is two things, which is one is regarding the program where pharmacists in Malaysia become vaccinated. And then another one is about how pharmacists now involved as a pharmacist consultant via a telehealth platform, which now makes consultation more reachable to those in need, where patients now don't have to see the pharmacist in person, in physical. They can actually consult the pharmacist online. So this is thing I'm going to share with you today. Okay, that's a history making as Malaysian pharmacists can now administer COVID-19 vaccination. This is quite new to us. Yes, of course, we know that other countries such as the UK and the USA had actually allowed their community pharmacists to administer flu vaccination for about 2 decades already. But this is something new for us in Malaysia. I'm not sure about Indonesia or other countries, but for us, this is quite, it's a really breakthrough for the pharmacists to be given the green light to vaccinate. Because all this while we know that when talking about vaccination, when talking especially during this COVID-19 pandemic, we know that vaccination has always been conducted by doctors and nurses only. So this is actually a happy news for the pharmacists in Malaysia. So pharmacists in Malaysia actually was successfully included in the COVID-19 vaccinators to help improve that and ramp up the inoculation rate in Malaysia starting from February 22 onwards. And also the pharmacists are trained to not only to inject the patient, but also trained to manage the cold chain storage, identify and manage the vaccine-related adverse effect. And especially this is for the pharmacists at the community pharmacies. And so this vaccination training program, we call it VTP, actually has been conducted in two sessions, which is VTP 1.0 and VTP 2.0. So this VTP for the pharmacists were organized by the Malaysian Community Pharmacy Group, MCPG. So partnered with the University of Nottingham, Malaysia, because the training, one of the module was done in the University of Nottingham, and also partnered with the St. John Ambulance Malaysia, where they actually help us and train us to for the basic life support, and also supported by Medicos, TP Healthcare, Dr. Tuyu, and others. So the VTP actually comprised of 4 modules, where the pharmacists will be equipped with theoretical knowledge, sort of like we have class, they present in the class online, and then we have practical assessment and clinical attachment at certified premises. Okay, this is the, okay, there are 4 modules in the, just to share you what was conducted in the VTP. And this is, we have 4 modules, okay. The first one is the online presentation, as I mentioned before, where the presentation was done by the officer from St. John Ambulance, where he presented on the basic life support. Actually not a presentation, it's more like a class teaching us on how to do CPR, what is important in CPR, how to identify whether patient needs CPR, and also on the on the choking, as well as how to identify patient having allergic reaction. So those are like emergency cases where pharmacists should actually have the knowledge and skills how to handle that kind of situations. And during this online presentation as well, we were introduced to the COVID-19 vaccines and administration. So this is where we were taught about how to keep the vaccines and other things. And upon completion of the program, pharmacists, vaccinators would actually master the vaccine administration, the vaccine constitution and storage, injection techniques, the pre and post vaccination counseling, as well as the basic life support. Myself, as I was one of the participants in the second VPP, so it was actually really interesting for me because especially when I learned and was trained on the basic life support, which is as a pharmacist, I think that is important. And then the second module, the pharmacist had to do the online test. So what we have to do is the online test and assessment on the vaccination and also the basic life support, where questions given based on these two. And but we have to pass 100%. There's no like 80% or 90%. Before we proceed to the next module, we have to do the test. We must get 100% correct. Then only we can move to the next module. So those who tried for the first time, sorry, can we go back to the previous slide? Okay, for those who fail to get 100%, they have to repeat the assessment until get 100%. So that's how it was. And in the third module is the practical training. So we receive hands-on training on basic life support, on how to do CPR. So how to manage the choking and allergy reactions. Before that, in module 1, we only receive theory. So this is how they teach us how to do it. So at the end of the training for basic life support, we had an assessment where pharmacists had to do the CPR on a dummy, and we will assess for the technique and had to pass it to get a certificate for basic life support. And we will also train on proper technique of injection and also on the cold chain management in practical training. And in the module 4, the last module, a clinical attachment for 2 hours where the pharmacists had to go to the certified trained vaccinators as premise and were trained on how to do the proper injection. So this time we did on the real patient and not on a dummy anymore. So okay, this is just some of the photos. So that's how this is during assessment of the CPR. So it was quite hard because for us, pharmacists, many of us, this is the first time for us. And then what we're happy is now pharmacists are now vaccinators. So this is something very new to us as pharmacists in Malaysia. Okay, next one is what I'm going to share is what we doing is about the telehealth pharmacist consultant. So as we all know, our traditional roles involve patient care, drugs management, or physical or face-to-face consultation, etc. However, there are times where, for example, we are not able to meet the patient in person, face-to-face, in physical. Maybe patient cannot go to the community pharmacy, but they need some advice or consultation. So in such case, digital technology is the savior for us and also for the patient, of course. And therefore, the role of pharmacists now should go, I think, beyond the traditional way of reaching patients. So as we see here, embedding technology in the practice can actually unlock the abilities of pharmacists to help care for the patients and improving our own job satisfaction and health outcome of the patient. So actually this is good for both we as a health provider and also for the patients. So in Malaysia, there's a telehealth platform developed where a group of pharmacists are involved in giving online consultations based on their specialties, and we provide consultation service for the patients mean for patients in need, because there are some patients they might want to stay at home, because actually this started during the pandemic where we all stay at home, but and we see that patients might need to talk to someone, but they were not able to go and see the pharmacist or the doctors in person. So what we have to do is to offer a new ways, to create a new ways on how patients can actually still reaching the healthcare provider even though they are at home. And then we see this as opportunities for the pharmacists to develop. And we know that this actually have been done maybe right before the pandemic as well. But for this one is what we call is Rises Telepharmacy, which is focusing on the pharmacists. Okay, this is a group of pharmacists involved, about 30 of us involved at the moment currently as pharmacy consultants. So this telepharmacy is a unique and innovative value-added services. We consider it as a value-added service that connects the public through the use of a remote state-of-the-art information and telecommunication technology, where we have pharmacist consultants and pharmacist practitioners and community pharmacists. So our background as a pharmacist, I'm saying our because I am also one of the consultant. So our background will be different area of specialty and different place of work. For example, there are community pharmacists in the group, there are pharmacist consultants, there are lecturers, and there are also pharmacist practitioners in the hospital. And we came from various fields of practice where we provide unbiased, accurate, reliable, and quality advice and guidance on health, disease medication, and also current health issues. We know that patients actually, they can just Google, because they can Google looking for something, but not everything is right. So what we need is to tell the community that instead of they just Google and read and without maybe the understanding they might misunderstanding certain things. So they actually can actually go right to the right person, to the pharmacist to talk about their health issues or anything they want to know about their health condition. So this is something that we think very important at the moment. Okay, the services currently, but this is not limited to what I listed here, but the services here involve, which is the online healthcare platform just now, involve these services such as medication use review, minor ailments, diabetic medication therapy, halal pharmaceuticals, quit smoking program, vaccination, even weight management, mental health, respiratory disease management, pain management, dermatology, and also on the CAM, the complementary and alternative medicine. But patient also, but this is not limited to the one that I listed here. Patient can also ask on oncology and cardiovascular disease. And we have many consultants involved based on their specialty. So they can actually ask the pharmacist based on what thing they want to ask. So this is the next slide is on the, okay, this is the example of one of the page in the website where patient, this is on medication use review. So patient can actually book the appointment for what they want to ask or what they need advice. So they can just book an appointment. So how this is done? Okay, what we have is patients can, first is a patient need to register as a, the as a user, so they need to register. And then so they have their own profiles, and then the next one is they can start using the website. And then what the next one is patient book the pharmacist consultant he or she has chosen. So she can when she go to the website, for example, under medication use review, there are a few consultants there. So she can book anyone that she would like to talk to. So she booked the consultants and then make a payment. And then a notification will be sent to both patient and consultant pharmacist with the links to the platform for consultation. And then at the same time, we have the customer service who is on standby to guide the consultation process just in case there's any problem with that. So basically, look at the flow chart. So this is how patient maybe already have a medication slip or they need advice, or so they want to talk to the pharmacist, or they may not have it but they need to discuss their condition with the pharmacist. So there's any possibility there, and patient can actually can be referred as well if needed to healthcare facility, or patient can straightly just talk to the healthcare professional provider, the pharmacist in this case. Actually, in this online telehealth service, we also have other professionals like optometrists as well, and not only pharmacists. But what I'm going to discuss is only on the pharmacy side. Okay, and so this is how it's done. So in the end, what we want is the objective to ensure the community receive proper consultation instead of they just Google and find out information from the Google and just read it and not sure whether that is correct or not. And then so the community receive a proper consultation related to their health. So this can be achieved. And even if the patient cannot see us, the pharmacist, or in person, for example, they can go to community pharmacy, but they need advice to ensure that what they taking, the medicine they taking is correct. So they can actually get the information online instead of just Google and read. Okay, back to the SDG. So I was talking about just now, there are 17 goals actually to transform our world. This is what the United Nations say. To transform the world, they have 17 goals. And the number 3, as you can see, is the good health and well-being. So what is related to us as pharmacists? So evolution of the pharmacist roles, which actually important to support this. So pharmacist involvement are not only related to the good health and well-being. So we also actually, for example, can look into other SDG as well, where pharmacists can also play important role. For example, the goals to achieve number 12 is to responsible consumption and production and quality education. So because we as pharmacists also involved in educating the patient, and also we also responsible to in the medication waste, for example. So those are the things we as pharmacists need to look into, and we support the SDG. Okay, evolution, not revolution. So we pharmacists need to do some evolution, but we don't do revolution. As you all know that community well-being is always our priority. Okay, as a pharmacist, we all know about this. And also educating the patient. Patient education is also our priority. We cannot let the patient know something about medication, for example, but they don't get the proper information, for example. So what we as a pharmacist, what we do is to educate the patient. Even those in community pharmacy, instead of just dispense and provide medication, at the same time we actually need to educate the patients. So what pharmacists and student pharmacists can and should be, what we should do is to be part of the larger initiative to improve the public health. Now we're talking about this is the public health. In particular is to reach the target in SDG number 3, which is the good health and well-being. So where we can actually ensure the healthy live and promote the well-being for all for patients through patient education in being part of policy development in our country whenever possible. And then talking about number 12, where drug waste also we need to minimize. So this is just additional what pharmacists can do is to look into the drug waste and the disposal of medications. This need to be done properly. For example, the paper, the plastic waste at the pharmacy business. So all this need to be done properly. How to to reduce the waste. So and then next, pharmacists also have evolved since many years ago to be part of the healthcare team in the system. And then as a healthcare team member, we don't work alone. Pharmacists can never work alone. So we need to be a part of the team. So at the end of the day, what we want to do is to support the SDG, of course, and to sustain the profession, the pharmacy profession. And the most important thing is to actually to really care for the community well-being. I think that's all for now. Maybe we can discuss more on the Q&A session. So I would like to actually acknowledge those who helped me with this presentation and also those who are involved during the vaccination training program. So the VTP, the vaccination training program, is I would like to acknowledge the Protect Health, Ministry of Health, Organizing Committee, and the MCPG, the BP Healthcare, St. John's Ambulance, and the Timing Stimulation. And for the pharmacist consultant, thank you to Mr. Munawar Ahmad for helping me with the presentation, with the informations, and also for giving us chances to be the consultant for as a pharmacist consultant. Thank you for now. I see you next in the Q&A session. Thank you.
All right, thank you so much, Dr. Saswiza, for very interesting presentations about the evolution role of pharmacists from Malaysian experience. Ladies and gentlemen, we will hold the questions at the end of the session. Hope Dr. Saswiza still can join with us till the end of the sessions. Right. If you have any questions, just feel free to later on write on your questions in the chat box. And also, if we have time, feel free to raise hand from the Zoom, and then we will. You can ask directly to the speakers. Ladies and gentlemen, now we are moving to the next agenda for our second speakers, Mr. Muhammad Samir Muhammad Sukeri. So I would like to say hi first to Mr. Samir. Hi Samir, how are you? I believe you're still on mute.
Yeah,
Yeah,
good.
all right. How are you, Samir?
Okay, fine. Thank you very much for having me here.
Yeah, we're all good here. All right, ladies and gentlemen, we are happy to have our second speaker here. Before Mr. Samir delivers his presentations, I would like to read his CV. So Mr. Samir is graduated from South Australian Matriculation Olympia College, Malaysia in 2005. He got a Bachelor of Pharmacy at Universitas Erlangga, so he's one of our alumni. And he's also completed his Master in Community Health at University Kebangsaan Malaysia in 2022. His current position is a Senior Pharmacist at National Cancer Institute in Malaysia. He has been a member of professional bodies as a registered pharmacist with the Lembaga Farmasi Malaysia. He's a lifetime member of Malaysian Pharmacy Society, and he's also a board member of Pharmacy Specialist Training Program at Ministry of Health Malaysia. Ladies and gentlemen, without further ado, please join with me to welcoming Mr. Muhammad Samir Muhammad Sukeri to deliver his presentations about pharmacy specializations, what is so special about it, the inside career pathway, and what it takes to specialize. Mr. Samir, the floor is yours.
Okay, hello everyone. Thank you very much. So I think everybody can see my slide now. Hello.
Yes, yes, we can see your slide.
Okay, again, I try to. Okay, there you go.
Yep. Oh, good.
Okay. Assalamualaikum warahmatullahi taala wabarakatuh, and a very good morning. So today we have a special lecture. Thank you very much to Universitas Airlangga Fakultas Farmasi, my alma mater, to have me here today. So maybe I will speak to you all in hybrid language, maybe sometimes in English, sometimes in Bahasa Indonesia, if you all okay with that. So today I will, from previous lecture, we already been taught by Dr. Zawiyah. Okay, if I'm mistaken, I'm sorry for if I, Zawiza, sorry, about insight, what is the pharmacy service all about. So today, for my session, it's actually I would like to touch on what is the specialization that we talked previously. Okay, so before we move on, so as you see, everyone that just kata orang kata apanya sedikit bercanda. Kadang-kadang when you working in the hospital, everybody are wearing a lab coat, same white coat. Sometimes we don't know who is it, but normally the pharmacy is always be the most clean one with the file and bringing out to understand to tell the doctors how is the medication and all about. So when we think about my journey from normal student sarjana farmasi di Fakultas Farmasi Universitas Erlangga to how to become a specialization. So I'm start from here. I think we all, if for the new student, maybe they don't know where is this. This is a campus B. Uh, this is me at that time. So I'm the oldest one at that time, and this is the second oldest, Mbak Ria. But now I think she is already been working in the rumah sakit, Sutomo, I think, ataupun Erlangga. So from this, when we are doing all this training, we learning everything. This is the process, I think. And then when I've been in the Elanga and also involved in Pramuka, and I've been sending off a lot of overseas attachment in UK, in Australia, since I've been in Fakultas Farmasi. So when we say that learning process is quite, ya, memang susah, memang sulit ya. Banyak praktikum, banyak lab, banyak exam, banyak ujian, dan akhirnya yes, I've been graduated. Not wisuda terbaik, tapi I'm graduated on time. Then my friend also, a lot of them is graduated and become some of them have become apotheker, some of them have become lecturer, and so on. So after I finished my pharmacy, and then I've been going to housemanship, and this is a required training, 1 year training. The purpose of this training is actually more on to give an insight, because when we bila kita belajar di fakultas farmasi, kita belajar semua, tapi we don't have, kita tidak punya idea bagaimana kerjanya, bagaimana experience-nya di lifetime-nya. Jadi with this training with houseman, so we will be going to every station that we have in the hospital, in the community, in the procurement, in the store, and what anything training that is related to the pharmacy. And for that 1 year, I've been learning a lot. Okay, but you know, this is the way we are doing. I'm get training in the second busiest hospital in Malaysia, in Sultan Aminah, Johor Bahru. I learned a lot, thousands of prescription. I've been right on dispensing a lot of medication, all this. And then after that, I've been upgraded to, I've been posted in National Cancer Institute. Little bit less busy. I have my own chair. I have it's a full IT system. My hair is still like that. And then in my department, I'm the only guys there as a pharmacist there. But it's a good experience. But normally when we go back to see back my journey, then is actually I'm still keep learning to become a good pharmacy. So when I'm grading, so all this lifetime journey is actually a process. to become wise 7-star pharmacist. I think everyone in Fakultas Farmasi, even in the pharmacists in the world, knows what is 7-star pharmacy, isn't it? So when we talk about it, now when we go for through back, apa yang kita belajar di Fakultas Farmasi itu is actually from me learning to the lab, sediaan sterile, sediaan semi-solid, preskripsi 1, preskripsi 2. Now this skill I've been brought to this new type of work, to become a caregiver, the manager, lifetime learner. So this one that we learn from the old school type of lab that we have in Kimia Fisika, now to become this one state of art modern facility, but we'll still keep learning to do it correctly and preparing the medication for the patient, and then after that I become a manager. After that training to a lot of students, a lot of housemen, a lot of assistant pharmacy to become a very competent production manager. I think you have to remember this machine yang very old school. We learn the normal one. This is the value that we have. Now become the manager. I've been preparing all this production, the cream, the suppository, even using the state-of-art technology and so on. So when we are doing this bakti sosial, KKM, all these field work outside of that, now I'm going for a lot of um, international conference. I've been in the previous line. If I will say that because from the things that we have heard from Dr. Zazwiza about the vaccination, you know that we have been through 2 years COVID-19 session. The pandemic is actually us as pharmacists is actually we have to do this voluntary work. We have to do the vaccination. I've been in the quarantine center, and then I going to home vaccination, and I also do this vaccination production, and then do all this sterile preparation, giving the vaccination for the people, so then we can go through this COVID-19 is down. Now I think now the COVID-19 cases is actually going down in Malaysia. So all these, I think now remember that we have do the presentation about community pharmacy. So all this will be continue when you are going to the real field. We have to do all this promotion, health promotion in the hospital. We are going to the conference, giving talks, giving all these new frontier. We're giving education to the people, and then also I've been get a lot of opportunity to go to Amsterdam, going to the Stockholm to for the FIP conference and so on. I've been presenting a lot of papers about what the things that we do in Malaysia, what we do in my specialty for the antibiotics, for the chemotherapy, oncology service, and everything. All this is actually showing that to become a 7-star pharmacist, you must to have this multi-talent skill. So when we have this multi-talent skill that we learn in fakultas, in the pharmacy sarjana, this thing we apply for the SDG. So you have to remember that the SDG main purpose is actually to ensure healthy life and promote well-being for all age. It means that you are a person that deliver menyampaikan perkhidmatan perubatan, medication, education, promotion to the people. That is you as a pharmacist. So sometimes on not so rare occasion, it happen to everybody in pharmacy student. You get lifelong learner and lifelong partner also. So I've been married to somebody there in the pharmacy in the faculty, my senior. Okay, so he been there. I'm still with her. She also are working as a pharmacist in community pharmacy. Okay, so everywhere we go, we have to bring her also. Is it? Okay, so even my lecturer also don't know we are we are married, but it's a lifetime partner that been together with me with this journey. So I think that's all is for the introduction. So normally when we doing I'm more to talk about you what is the things, the experience that we have in hospital pharmacy. Okay. So a little bit about it. The Oops, okay, this is about me. Okay, so now I'm been working as a pharmaceutical and manufacturing service pharmacist that involved in this major core service, which is a cytotoxic reconstitution service, parental nutrition service. We also become a center of excellence for training. A lot of private hospital, even the training, from the international students are coming to our place to train on oncology service. So I'm being in charge for manufacturing and repacking service. So I'm be apply all this pharmaceutical knowledge, and also I'm being involved for the safety and occupational health in our place, my workplace. So enough with the introduction. I think quite long introduction just now. So now we are going to the main topic. What is the pharmacy specialty? So we kalau kita cerita pasal kita menjadi seorang farmasis ataupun apoteker, setiap farmasis, setiap apoteker itu pasti ketahui bagaimana menyediakan preskripsi, memberikan konsultasi tentang obat-obat, juga bisa menjadi manager untuk pabrik pembuatan obat, QC, QA, atau juga menjadi seorang farmasi komunitas, memberikan perkhidmatan kesihatan kepada ataupun pelayanan kepada masyarakat. Now, everyone as a pharmacist know about it. So now we are going through to become more specialization. Is a job title that certified you as a become special that offers specialized service. Maksudnya servis perkhidmatan khusus yang diberikan kepada kepada masyarakat, yang dikhususkan itu sebelum kamu dikhususkan itu, yang diberikan itu specialization itu, kamu di train, kamu di certified kan, jadi kamu di acknowledge kan, jadi diberikan latihan dan sebagainya, akhirnya kamu menjadi seorang farmasi yang special gitu. Okay, but it's not necessarily that you need to have S2, harus mengambil S2 atau S3. That one is to become added bonus. You become specialist through the training, experience along when you are working, credentialing and privileging. Okay, so to give you the idea why need to become a pharmacy specialty, we have to go to that through a little bit later. So because we are evolving from dulu kita kalau mau kata memberikan pelayanan obat, kalau orang sakitnya pilek, kita kasih aja PCM, kita kasih aja antibiotik atau sebagainya. Now, when we going to become specialty in the future, the medicine will be moving from traditional type of medicine that giving same medication to all to translational and precision medicine. So when we go into this era, okay, this era, now the technology of the medicine is become evolving, become better and better. Now we are going to specialize, specifically giving medicine to the individual needs. So we are now aim to improve predictability and successfully diagnosis using biomarker. We can have a lot of machinery. So mean that afterwards, in moving forward, when we have cancer, for example, you have cancer, we can give a very specific dose, specific treatment, specific target therapy that been used. So then from that, we can reduce the cost. We can give a better outcome for the patient, reduce the mortality. At the end of the day, the medicine accessibility become wider and wider and wider. Okay, so semakin kita menuju ke depan, kita juga harus maju juga ke depan supaya profesi kita tetap unggul dan juga tetap menjadi keperluan ataupun kebutuhan kepada perkhidmatan dan pelayanan medis yang ada di dunia. Okay, so that is the thing, the intipatinya. Okay, and then bercerita tentang SDG 3 2030 ya. So number one is we have to closing the gap of the medicine accessibility and reduce mortality. Okay, with that perspective, medical specialist service offered into rural and regional area. Nah, dulunya kita kalau mau dapatkan perkhidmatan spesialis, kita harus pergi ke rumah sakit yang besar-besar di kota. Nah, sekarang ini menuju kepada SDG 230, semua masyarakat, tak kira daripada orang yang duduknya di desa, di pelosok dunia, di ujung-ujung dunia manapun dia pergi, kita harus menyampaikan accessibility, ya, akses kepada medicine atau itu kepada mereka. Nah, bagaimana kita menyampaikan perkhidmatan spesialis kepada mereka? Ya, itu tadi yang seperti yang diceritakan oleh Dr. Zawiza itu, telemedicine, perkhidmatan kepakaran kepada mereka di rumah sakit, di kampung-kampung, desa dan sebagainya. Nah, itu akan menjadi normal, jadi normal kepada kita nanti pada akan datang, ya. Nanti datangnya ada AI, revolusi teknologi, IR 4.0 dan sebagainya. Itu semuanya nanti akan menyebabkan kita jadi orang yang tidak bisa menjadi farmasis yang biasa-biasa. Kita harus menjadi orang yang spesial. Okay? Nah, cerita, of course when we want to become a specialized pharmacist, it will give you a very valuable set of skills. These skills will reflect to the increment of the value of you. Okay, mungkin gajinya lebih banyak, jadi job security-nya lebih baik. Jadi orang pastinya pingin kamu kerjanya di sana, gak mau orang lain, kerana kamu yang lebih baik daripada orang yang lain. Ya gitu. Okay, kamu bukan biasa-biasa. Nah, mungkin kalian tidak mempunyai idea, kalian have no idea what is the specialized pharmacist in there. So it's something that is for example like cytotoxic CDR pharmacies, nuclear pharmaceutical pharmacy. We have also a pharmacy that involved in nutrition. This one I think everybody know, traditional medicine pharmacies, pharmacy ubat tradisional. But this thing is very new. Cyber security, digital forensic pharmacy, maybe some pharmacies are involving to the public health promotion, and also some pharmacies that been involved in creating a new type of drugs like biosimilar pharmaceutical pharmacies. And then even if you become pharmacy klinis, kamu belajar farmasi klinis, farmasi rumah sakit, itu kita tidak hanya sekadar menjadi seorang farmasis yang hanya memberikan nasihat kepada tenaga medis ataupun kepada masyarakat. Nah, kalian itu nanti akan jadinya farmasis yang pengkhususan kepada jenis tipe-tipe penyakit yang ada, seperti farmasis yang pengkhususannya di diabetes, pengkhususannya di onkologi, pengkhususannya di di nuclear farmasi dan sebagainya. Jadi itu akan menjadi clinical specialist pharmacist. Okey, selain itu kita juga akan punya farmasis yang akan mengurusin masalah narkoba. Ya, masalah narkoba itu jadi drug abuse counselor. Okey, ada juga farmasis yang akan mengurusin masalah-masalah penggunaan antibiotika yang tidak bagus, dan tidak benar dan sebagainya. Itu yang akan menjadi yang dikatakan specialized farmasi. Masih tidak mendapat ceritanya? Okey, kita lihat ini. Nah, di Malaysia itu kita sekarang sudah mula menuju ke arah teleconsultation, telemedicine seperti itu. Nah, kebanyakan rumah sakit yang non-government, ya, private, itu sudah mulai menuju ke arah itu. Nah, sebagian itu juga kita juga sudah mula mempromosikan alternative medicine, okay, traditional Chinese medicine, traditional Malay medicine dan sebagainya. Nah, sekarang komunitas farmasi komunitas juga sudah mulai evolusi. Jadi mereka juga mulai cerita pasca COVID-19 itu mereka sudah mulai menuju ke arah online farmasi. Jadi farmasinya itu perkhidmatan apotekernya itu sudah jadi di virtual ya. Even sebagai private di government juga kita mau menjadikan akses obat itu kepada semua. Jadi kita punya perkhidmatan aplikasi di apps untuk perkhidmatan obat di rumah, ya. Dan juga semakin canggihnya, semakin hebatnya teknologi, semakin berkembangnya teknologi, kita juga mempunyai perkhidmatan onkologi yang lebih baik dan lebih teliti dan lebih bagus kepada masyarakat. Seperti itu. Okey. Nah, so kalau kita cerita, what is the basic knowledge that we have to become a good way? So pastinya kalian kita belajar di farmasi ataupun di sarjana itu kita belajar semua kan. Kita juga pastinya nggak tahu mau yang kemana, mau farmastika kah, mau fitokimia kah, mau farmasi klinis kah, mau masuk komunitas kah dan bagaimana kita nggak punya ide gitu. Nah daripada sekarang itu kalian coba lihat, kalian juga lihat kepada minat kalian. Minat apa? Kalau kalian contoh kalian suka matematika, juga fisika. Nah, di farmasi kalian suka kimia fisika, farmakokinetika, belajar itu tentang obat-obat, gimana obat jalan fisikarnya. Nah, kalian bisa menjadi radio pharmaceutical and nuclear pharmacist. Nah, nanti akhirnya nanti kalian bisa menuju ke arah itu. Nah, contoh lagi yang lain, kalian melihat suka biologi, suka kimia, so, kayak gitu. Jadi suka botanik farmasi, suka farmakognosi, kalian suka barang herbal-herbal, segala-gala herbal yang ada di dunia. Kalian suka belajar tentang obat pohon, bijinya atau sebagainya yang mau dijadikan obat. Nah, eksplorasinya itu kalian bisa menjadi spesialis kepada traditional medicine. Nah, itu. Kalian itu kalau menjadi spesialis medicine, itu sekarang di US di negara Eropa itu sudah mulai mengiktiraf orang-orang farmasi traditional medicine ini. Jadi akhirnya mereka bisa membuka praktisi di sana. Oke. Seterusnya, kalian suka fisika, suka kimia, tapi nggak suka biologi. Kalian suka cerita pembuatan obat-obat baru, suka sterile, cerita pembuatan obat liquida, semisolida dan sebagainya. Kalian bisa bekerja di bagian saya, yaitu kerja yang sterile production, manufacturing, even GMP pharmacy. Kalian bisa jadi good manufacturing manager dan sebagainya. Ya, nah, kalian suka biologi, nggak suka fisika, nggak suka kimia, tapi suka art sedikit art lah, seni, suka belajaran sejarah dan sebagainya, suka farmakologi juga, suka farmakoterapi, suka melayani pesakit. Nah, kalian jadi spesialis farmasi aja, jadi orang yang suka ngomong sama sakit saja, suka pada pasien, nah, jadi spesialis farmasi dan sebagainya. Nah, kenapa kita bercerita pasal ini? Nah, pastinya kalian lihat banyak jurnal-jurnal di dunia itu sudah menceritakan bagaimana apabila kalian menjadi spesialis farmasis itu kebanyakannya sudah mulai di-upgrade jadi konsultan, jadi high rank CEO, manager, junior manager dan sebagainya. Jadi apabila mereka mulai sebagai sebagai contoh saya dulunya junior, sekarang sudah menjadi senior farmasi yang sudah mulai training specialization kepada sterile production dan manager. Kalau saya itu pergi keluar kerja di rumah sakit yang spesial di luar, itu pastinya value saya itu sebagai farmasi yang khususannya sterile preparation itu jadi lebih baik, lebih bagus, lebih tinggi gajinya dan dibandingkan dengan farmasi yang biasa-biasa aja gitu. Nah, banyak cerita, banyak paper ya, banyak jurnal juga yang menceritakan tentang kepentingan, keperluan ya, needed to have this specialized pharmacy in the hospital, in the community, in the international, in the industry. Okay, so banyak cerita yang dimana apabila kalian menjadi seorang farmasi yang spesial, yang kalian sudah menjadi orang yang dapat memberikan pelayanan masyarakat yang benar, tepat, yang lebih kritis. Nah, ini akan kembali kepada kita sebagai orang yang bekerja di aspek kesihatan itu, dia akan menghematkan uang kerana kita memberikan obat-obat ataupun pelayanan yang tepat dan tepat guna gitu ya. And then the second one is actually we are going to have value, giving value. Okay, pasien juga lebih suka menceritakan masalah mereka, kesihatan mereka kepada orang yang lebih mengetahui ataupun specialize in that particular area gitu. Okay. Nah, bagaimana kita menjadi seorang yang spesialis? Nah, pastinya bila kita menjadi seorang yang spesialis farmasi itu, we have to go to training. And then to become recognized worldwide, we have to get certified. You have to get privileging. Nah, bagaimana kita jadi itu? Jadi kita nggak bisa langsung lahir daripada Fakultas Farmasi Universitas Erlangga, kamu langsung jadi orang yang hebat terus. Walaupun IPK kamu 4,00, nggak bisa. Pastinya harus punya training yang khusus. Jadi harus melalui specialization, certification, training dan sebagainya. Nah, di dunia ini banyak, di dunia ini banyak sekali sertifikasi ataupun recognition yang diadakan, yang boleh digunakan di mana-mana saja. Jadi kalau kalian punya sertifikasi ini, kalian pergi saja mau kerja di negara Taiwan kah, Hong Kong kah, China kah, di UK kah, US kah, London atau sebagainya, kalian bisa bekerja di sana. Itu maksud saya. Okey. Nah, kalian mau jadi clinical pharmacy, ambillah board specialty pharmacy. Mau jadi seorang dosen yang bagus, yang hebat, bisa mengambil band high E certification. Mau jadi seorang farmasi yang pengkhususannya kepada sediaan nuklear, bisa mengambil EAM certification. Mau jadi seorang farmasi komunitas yang hebat, yang bagus, yang memberikan pelayanan kesihatan yang lebih baik, bisa juga mengambil pain specialist ataupun smoking cessation, yang itu memberikan advokasi tentang smoking. Jadi nggak mau orang smoking, kita mau dia jadi lebih baik. Nah, itu. Dan juga bisa menjadi complementary medication pharmacist. Ada sertifikasi berkenaan dengan ini. Dan ada certain sertifikasinya itu yang sebenarnya diberikan gratis. Jadi kalian bisa belajar aja, nggak ada masalah. Kalian daftar, belajar, kalian pikir kalian sudah ready, sudah mau jadi nutritional support pharmacist yang bagus, yang hebat sekali. Nah, kalian bisa mengambil ujiannya dan lolos, dan akhirnya jadi certified pharmacist. Nah, gitu. Okey. Nah, begitu. Akhirnya, jadi sebagai kayaknya waktunya udah cukup ya. Menutup, kita cerita tentang itu. Jadi saya bilang apa yang kita belajar di Fakultas Farmasi, apa yang kita go through the journey from the pharmacy, is actually we just melukis, melakar garisan dengan pensil. Jadi itu hanya sekadar perencanaan kalian kepada kalian mau menjadi farmasi seperti apa. Nah, gitu. Nah, apabila kalian sudah ada targetnya, sudah ada tahu ceritanya apa yang kalian mau buat, nah akhirnya kalian lakarkan itu menggunakan pen. Jadi kalian terus mengambil kepada jurusan itu. Nah, jadi kalau jadi farmasi itu jangan jadi semuanya. Kalau mau jadi farmasi dispensary, kalian mau jadi farmasi rumah sakit, kalian mau menjadi farmasi klinis, jangan. Kamu jadi pengkhususan. Kalian khususkan farmasi sekali, perkhidmatan profesional kalian itu. Jadi akhirnya kalian menjadi orang yang lebih value-nya lebih tinggi, dan orang mau Anda kerja di mana-mana saja di dunia, Anda pasti dibutuhkan. Okey, sip. Nah, sebagai penutup, kalian saya berikan sedikit short video, on what the things that we do in Pharmacy National Cancer Institute, what specialization in sterile preparation manufacturing in oncology pharmacy. Okay.
Ubat kemoterapi merupakan ubat yang digunakan untuk sel kanser. Setiap ubat kemoterapi yang diberikan secara intravena kepada pesakit perlu dibuat di unit farmasi farmasitical. Tetapi adakah anda tahu bagaimana Jabatan Farmasi Institut Kanser Negara melakukannya? Mari ikuti saya untuk ketahui bagaimana kami memastikan ubat yang diberikan kepada pesakit selamat, tepat dan berkualiti. Setiap ubat yang diterima dari pengeluar akan tiba di unit perolehan dan pembekalan farmasi, seterusnya diterima oleh petugas stor. Ubat setotoksik mempunyai cara pengendalian khusus dengan tanda-tanda khas di pek pembungkusannya bagi menjamin keselamatan ubat dan kaki tangan yang mengendalikan ubat tersebut. Unit Pharmaceutical Institut Kanser Negara terletak di atas 5 dan mempunyai sebanyak 4 ruangan bersih berteknologi tinggi dan 2 dikhususkan untuk penyerahan ubat setotoksik.
Video tak.
ubat dibuat, setiap regimen rancangan pengobatan pesakit akan diminta oleh dan onkologi akan melalui proses salinan individu. Doktor serta pakar onkologi akan meneliti protokol pesakit dan memesan ubat kemoterapi pesakit melalui sistem khas onkologi yang dipanggil mozaik. Pegawai farmasi seterusnya menyemak dan memastikan ubat-ubat yang dipesan adalah tepat dengan protokol, dos yang betul serta pesakit dalam keadaan sihat dan bersedia untuk menerima ubat kemoterapi pada hari ini. Bagi memastikan keselamatan kaki tangan dan juga ubat yang disediakan, kaki tangan yang masuk ke bilik bersih perlu memakai pakaian khas dan melakukan hand washing untuk menjamin kebersihan kaki tangan sebelum masuk ke ruang bersih. Tiap label pesakit diperiksa semula oleh kaki tangan di bilik komponen sebelum dibawa masuk ke ruangan sediaan cytotoxin. Ubat tersebut kemudiannya dibersihkan di permukaannya dengan alkohol sebelum proses membaca ubat tersebut dilakukan. Setiap ubat cytotoxin dibuat mengikut standard penyediaan ubat steroid yang telah dikeluarkan oleh Bahagian Perkhidmatan Farmasi Kementerian Kesihatan Malaysia. Ubat disemak semula oleh pegawai kualiti bagi memastikan tiada pencemaran benda asing dalam ubat pesakit, label dan ubat yang betul serta dos yang tepat mengikut kertas kerja yang disediakan. Dispenser akan bertanggungjawab membawa ubat tersebut ke kaunter penerimaan untuk diambil oleh jururawat bertugas. Jururawat terlatih akan menyemak semula ubat yang dibuat dan memastikan ubat yang diterima adalah betul dan tepat. Sekarang anda telah melihat bagaimana ubat kemoterapi dibuat mengikut standard tertinggi dengan kemahiran terunggul oleh kaki tangan Jabatan Farmasi. Ingatlah, bukan mudah proses membuat ubat kemoterapi ini kerana ia memerlukan ketelitian yang tinggi. Ini merupakan jaminan kami di unit farmasi Pharmacists Institut Kanser Negara dalam menghasilkan sediaan farmaceutical yang berkualiti, tepat dan selamat.
Okay, nah itu jadi itu yang what we do, okay, what we do in National Cancer Institute, because my hospital, National Cancer Institute, is actually specialized in oncology service. So we are totally for oncology service, but at the same time, the core service that we have in the pharmacy department is actually this chemotherapy. Okay, so I think that's all about it. A lot of things that we want to share actually, but this is actually maybe giving you some idea, maybe some insights of what we doing in future. We want you not to become an average pharmacy, but we want you to become a very good certified specialized pharmacy. So then this is will give you a secure to our profession that we are always been evolving. We are going towards competent pharmacists, that we are always been needed by the pharmacists, by the medical profession. So then we not losing out. Okay, so kita harus setiap kalinya kita harus evolusi sebagai farmasis yang kompeten, sebagai farmasis yang hebat, yang spesial. So then akhirnya kita itu tidak akan menjadi profesi yang akan orang kata akan ditinggalkan, ya, dipinggirkan gitu. Nah, if you have any question, you can do it in the Q&A session afterwards. Masa inilah kalian bisa ngomong, tanya apa aja yang ingin ditanyakan. Nah, in future, if you like to have a collaboration, research, ataupun mau pingin datang ke sini melihat gimana bentuknya, belajarnya gimana dan sebagainya, do contact me through this email. Okay, thank you very much. I think that's all. I will stop sharing. Okay, saya kembalikan ini kepada community. Thank you very much.
Thank you so much, Mr. Samuel, so for a very interesting presentation and also very good video to show us about the role of pharmacists and your job in the National Cancer of Institute. All right, ladies and gentlemen, we are entering for the discussions, the Q&A questions. So if you have any questions, if you want to ask directly to the speakers, you may raise hand if you are joining from Zoom. And if you have any question that in Indonesian language, feel free to either in Indonesian language or English, you can ask directly writing in the chat box. As I mentioned earlier, that due to for the unforeseen circumstances, that Dr. Siba is apology cannot join with us. So now we are entering the discussion and Q&A questions. I have received a few questions from the audience. So while we are waiting for the audience to raise hand, just gonna read the questions that I received. Okay, so Dr. Saswiza is also joined with us now. Okay, so the first questions is for Dr. Saswiza. The audience would like to ask, and from your CV, you are also concerned about the mental health issues, which one of the goals of the SDGs 3, about promoting mental health and well-being. Can you tell us in more details how the role of pharmacists, particularly in Malaysia, regarding the mental health issues?
Okay, thank you for the questions. Okay, myself, me as a lecturer, basically I'm a lecturer who's teaching psychiatric and neurologic disorders for the pharmacy students. And of course, my research interests would involve the mental health. And because I was also a community pharmacist, so I collaborate sort of like, looking into the possibility, how can we connect the mental health issues to pharmacists, the community, especially the community pharmacists, as one of their intervention. Well, in Malaysia at the moment, to be honest, I don't see this is actually done actively. Maybe there are pharmacists who do sort of like consultation, but just briefly, because at the moment we don't have a proper training on the how to handle issues related to mental health among the community pharmacists, especially. But we do have in the hospital, we do have pharmacists who is specialized in psychiatry, but that will be in hospital Permai and hospital Tanjung Rambutan, which both are the psychiatric hospitals. So we do have pharmacists specialized on that. But for community pharmacists, at the moment, we're still looking into proper way, as we can see in the SDG needs to look into the good health and well-being. So which this is also include the mental health issues as part of the well-being. So we are still trying to develop a few training or any interventions as academician from the universities, what we can do to help improve this intervention at the community level, especially in pharmacies. So at the moment, I can't really share what the community pharmacists do, but from our part as academician, and especially in my university, we actually looking into some proposals where we can intervene as pharmacists to help with the mental health issues. So basically, to be honest, that we are really looking forward for this. Maybe by next year, and we can have something to intervene as pharmacists.
Yep.
All right.
I think I have
Yeah.
that answered the questions.
Yes. Okay. Thank you so much, Dr. Saswiza. So I see Professor Bambang Tripurwanto raise hand. Prof. Bambang. Yeah.
Okay,
Monggo,
thank
Prof.
you.
Bambang.
I will ask to Mr. Samir.
Yes.
How are you?
Baik, baik. Yeah.
I hope you remember me, okay?
Pastinya.
Yeah. Now, I agree with your idea as a specialist of pharmacist. Yeah, it's my idea too for a long time. Yeah. The field of pharmacy is closely related to medicine to medicine. So pharmacists can also follow specialists in medicine. So they can become like orthopedic specialist pharmacists. Okay, for example, or maybe pediatric pharmacist specialist.
Yeah.
Of course, this must go through an education that can be collaborated between educational institution and a professional organization. What do you think about it? Okay, Mr. Samir?
Yeah. When we talk about specialization in the pharmacy, okay, so what we know is actually when we say about pharmacy, okay, everybody know we are dispensing drugs. That is the thing that we only know. Even if you go to community pharmacy, they know that we have to go to pharmacy just to get drugs, medication, and what the things that they have for their alignment. Okay, so from apa yang mau diceritakan oleh Bapak, which is we are going to certify this specialization, okay, di farmasi, maksudnya daripada dia hanya menceritakan tentang obat-obat yang biasa-biasa aja. Nah, dia bisa menjadi specialization in diabetes. Contoh ya, ataupun di komunitas sekarang di farmasi di Malaysia kita sudah mulai sertifikasi mereka untuk memberikan pelayanan tentang diabetes sama stop smoking. Okay, ataupun herbal medicine. Now, from that certification, training, specialization, we give you training, everything with the experience go through. Apabila mereka meletakkan title, ya, title, I am a specialized pharmacist in diabetes, in herbal medicine, in orthopedic, in pediatrics. Itu akan memberikan keyakinan kepada masyarakat, ya, memberikan orang impaknya itu the people are believing you as a pharmacist can provide that service in the community, in the hospital, in the industry. Okay, so that we are going towards to that. So when we are going to the pharmacy, we just not only to get advice for just a normal alignment. We can get advice not only for the medication, we can get advice for the nutrition, we can get advice for what type of the medication or diagnosis that you need to do. But it's still limited to only for the medication purpose, not for the diagnosis of the disease and whatsoever. Okay, so ya Pak, sekarang di Malaysia itu sudah mulai mengkhususkan komunitas farmasi itu mau diangkat memberikan pelayanan yang lebih khusus spesial kepada masyarakat. Nah, jadi aim-nya itu akhirnya kita mau membawa perkhidmatan spesialis yang di rumah sakit yang besar-besar itu, yang gede-gede itu, kepada pelayanan di desa-desa, di kampung, di kota-kota kecil. Jadi how we do that now is actually when we are going for evolving to the telemedicine, apa yang dikatakan oleh Dr. Zawiza. Jadi kita menaikkan telemedicine in Malaysia. We are trying to go there. And then also now we are going for to use the standard resources that we have. Okay, kan di Malaysia, di Indonesia, di Thailand itu perkhidmatan capaian internetnya sudah mulai meluas kan. Jadi semuanya orang bisa akses kepada internet. Nah, akhirnya kita juga akan harus evolusi daripada traditional pharmacist going to the virtual pharmacy, something like that. Nah, jadi itu juga peran kepada fakultas untuk menyiapkan anak-anak kita, mahasiswa kita yang akan datang itu terus menjadi farmasi yang up to date, gitu ya Pak. Saya harap menjawab ya soalannya. Yeah.
Okay. Thank you, Mrs. Samir.
Yeah.
Give my best regard to your wife, ya, Siti Balkis.
Thank you. Ya, dia ada di situ.
Alright, thank you so much, Prof. Bambang. Thank you, Samir. So there's one question from the chat box that I would like to read as well from Mr. Burhanuddin asking to Dr. Saswisa. Thank you for very insightful presentations. I'm curious, in this era of disruptions, how should we respond to the phenomenon of selling medicine online through the marketplace without counseling from pharmacists?
Ini memang susah.
Okay. Thank you for the questions. Actually, the situation is, we worried about this. We among the pharmacists also talk about this. But personally, we as a pharmacist, we can't simply just attack for example, we saw something in Shopee, for example, then we can't simply attack the seller. Why are you selling this and why you are not, certified to selling medicine, for example. So for us in Malaysia, because we have rules and regulations, so the things that as pharmacists, if you see something like this, we lodge a report to our enforcement, for example, and so this is something that where those pharmacists who involved in the laws, but in the policy, well, we have here the enforcement officers where they are actually pharmacists. So this is something then later they would do and investigate and do whatever they're supposed to, to handle this situation. But as for us, we don't agree. But as a professionals, we're not supposed to personally attack the seller. But looking at the situation, yes, this is something that we worry about. And then personally, as a pharmacist, we also keep looking into the website, Shopee sometimes, and some reported to us, even we as an academician as well. So what we should do about this? So the thing that we can do is, officially we lodge a report and they will take action on this. So at the moment, that's all we can do, because we cannot stop the internet. We cannot stop people from Google. We cannot stop the seller from uploading what they want to sell. And because they get once they get the income, they see they're selling medication without, they are not certified to sell, but you see the income is coming into your account, and they won't stop until we have to do something. But we as a pharmacist or healthcare providers, what we do is do official report. So that's all we can do in Malaysia.
Can we add? I add a little
Yeah,
bit.
sure, please.
Okay.
Syamil can something too.
But the thing is actually, what the thing that Dr. Zawiza said is very true. It's not only big happening in Malaysia. I think in Indonesia also same. When we're going to have this online selling, all this Shopee, all this Lazada, we cannot control. Okay, so what the thing that Malaysians do is actually just to regulate. Okay, we have a need. But from all this, we cannot control who are selling, but we can control who is buying. How we control them is actually through the health promotion. So now the pharmacy is actually now towards to the public health sector. So we have to empower pharmacists to do this health promotion. What the thing what we have now done is actually we're going, kalau di Malaysia itu sudah ada mulai Twitter berkenaan MedTweet, for example, that giving this advice to the patient through Twitter, to Facebook. So what we want to empower the community now is actually to memberikan edukasi kepada masyarakat apabila dia mau membeli obat atau buying a medicine in Shopee online, when they have to have doubt, and they must to have things that apabila aku mau membeli obat harus mencari farmasis untuk mendapatkan advice. That's the thing. So we now trying to do, when people want to buy medicine, get advice to the pharmacy first. So that the thing that we want to empower the community. Apabila kita mau menceritakan, kita mau mengontrol, tak bisa, pasti tak bisa. Di mana-mana pun, di Malaysia kah, di Indonesia kah, di Europe kah, di Thailand kah, di Singapura, sama saja. Semuanya tak bisa. Nah, apa yang kita bisa boleh lakukan? Mengedukasikan masyarakat. Nah, itu peran kita sebagai farmasi. Okay, that is our role as a community pharmacy, to empower the people. Okay.
Okay, that's a very good question. Dr. Saswita, do you like to add more?
I agree with Syamil, setuju. Because we cannot control, so we as a pharmacist, either you in the hospital or community or lecturers, academician, all we have to do is continuously educate the public on how important for them to seek advice instead of just simply buy online or this kind of things.
Yeah, okay. I think that's such situation is also happening in Indonesia, because Mr. Samis also mentioned about one of the biggest online shopping, Lazada, Shopee. Probably you are already familiar with that kind of online shopping. So I think that's agree with that statement that anybody can sell a drug online, but anybody also can choose whether they want to buy online or not, or whether they can get advice always from pharmacists. All right, thank you so much. We are moving to the next question. I saw in some chat box here, there's a questions from Sarah Dia that's asking about the pharmaceutical field is broad-ranging from the pharmaceutical industry, distribution areas, clinical and community pharmacy. And as far as I know, the certified specialty still exists in the field of clinical pharmacy. And what about the areas of pharmacist expertise? Is it necessary to develop specialized special education to certify? I think Mr. Samir, you can share with us about these questions.
Okay. What I can say that when we talk about specialization in the pharmacy, everybody know is clinical pharmacist. That's the thing that we know. You know what? A lot of my friend, okay, my batch is actually not only to become a standard pharmacist in the clinical pharmacy, but they also going to involve to the industrial practice, going for the community pharmacy. Okay, as some of them become academician, okay, become a professor, become the lecturer. If you want to go through that, you have to go through the training. If you go through only become a normal pharmacist and then you become a lecturer, then you will deliver normal pharmacy lecture. But if you go through to become a lecturer with this certification, okay, you will train future pharmacy with this specialization also, isn't it? Okay, so it's not only for certification of clinical pharmacy. Nowadays, we are now certified community pharmacy to give pain clinic. Okay, I think I remember, but my wife is also involved in this pain module. So that in future, pharmacy also can give advice and consultation on pain clinic. Okay, for pain. Diabetic pharmacy is clinical. Okay, so they will already involved. Oncology also clinical. But how about procurement or store management? Yes, we have clinic specialized pharmacy for that. We call it cold chain practice. So we certified pharmacists to involve in this cold chain pharmacy in the industry. And then for people that is involving in the pharmaceutical unit for the sterile preparation, everything, we have GCP certification, good manufacturing practice. We have GCP certification, good clinical pharmacy practice. All these certification will enhance you as a pharmacist to become certified to deliver sterile preparation manufacturing, for example, like that. So how about industrial, pharmaceutical industrial? We are now certified pharmacy in the industry to deliver QA QC certification. That one you need to have certification for that purpose. And then I think now we have this AI technology certification. We have cybercrime pharmacy for the certification for to control all this medication in the online. Now we are going to evolve to the virtual. The telemedicine also, we have to give them not on. We have to equip them with this cybercrime law, for example. This one need to have certification for that. So all this will be necessary to develop special education, isn't it? So now we can see that in the pharmacy dekat fakultas also sudah mulai kita menuju ke arah itu. Jadi kita juga akan memberikan pengkuliahan berkenaan tentang idea-idea tentang jawat apanya orang kata farmasi-farmasi yang special ini. Jadi nanti akhirnya when you learn in pharmaceutical department, you also learn about GMP. You also learn about GCP, something like that. When you going to the community pharmacy, you also maybe been taught about how to be certified to deliver this specialization and so on. So even I think Dr. Zawiza also have been mentioned in the previous kuliah that they also going to evolve this community pharmacy to vaccination, isn't it? So this vaccination also need to be certified. There will be certification for that. So the learning curve is not start after you finish or graduate. The learning curve is start when you entering to the pharmacy.
All right, Okay.
I think that's all.
So
Yeah.
that is to say, thank you so much, Dr. Saswiza. I mean, related to the what statement by Mr. Samirs is about the certification for pharmacists as vaccinator. Is it also that after they finish the training, they got the certificate, right? So is that can they can say as they are a specialized pharmacist as a vaccinator, or they do need just enough to get that certificate means like they are specialized in as a vaccinator or pharmacist?
Okay, actually the training, the VTP vaccinators is initially is meant started this because of the COVID-19, the pandemic. So they look into that. Because basically before these doctors and nurses are the vaccinators. So they applied the MCPG, the Malaysian Community Pharmacy Group. It's an association of the community pharmacies applied whether there's a possibility that pharmacists, the community pharmacists get certified where they can become the vaccinators. They can provide vaccine at the community pharmacy. Where at the moment, I think that we haven't started yet at the premise community pharmacy yet, but we have around 300 pharmacies already certified as vaccinators for COVID-19. So there's a possibility that even the COVID-19 has going slowing down, but we don't know what will happen in the
Okay,
future.
okay.
So we were actually already ready that we have around 300 pharmacists who can actually provide vaccines in additional to doctors and nurses. So basically the trainings is we get certificate. We are certified vaccinators.
Yeah.
And this is certified also by the Ministry of Health. So those who attended the training are considered as certified vaccinators that they can vaccinate the vaccinate the community, the people lah. And then apart from that, we also get another certificate which is the basic life support certificates. So we are also able and we are trained and able to provide the basic help, the basic life support like CPR and choking and allergic reactions, all those things. I think this is very good for those who attended. This is extra skill, advanced skill actually for pharmacists, because all we know is pharmacists usually when we talk about pharmacy or related to medication, the drugs, that is what the people see pharmacists as. But now having extra skills, now we actually have to me, I think I have more confidence to say that I'm a pharmacist and I can do basic life support as well, and I also can vaccinate people. So, you know, that type of feeling that you are a pharmacist, not only know about medication.
Yeah,
So,
yeah,
yeah.
yeah. And I think is it in the future like after then the pharmacist as a vaccinator is also can do like any other vaccines like not only for the COVID-19, right? In the future.
We can,
Okay.
because, yeah,
And
because of the
then
certificate,
do they
yeah, we
have need to be affiliated in the hospital or they can just do a practice at the community pharmacy?
Yes.
Oh,
To
okay.
moment the plan is if they have a good the premise actually
yeah.
as a certified vaccinated place, then they can do it there. But at the moment, the plan is they can go to the what we call is PPV, the
Quarantine.
pusat vaccination, where the pharmacist can not only involve as before this we go as a pharmacist, but we are not the vaccinators. But after this, those who certified, they also can go there as vaccinators. That's the plan at the moment.
To add more, actually, we don't know what happen in the future. Okay, so the purpose that we are doing that vaccination program been delivered by the pharmacists, because when the pandemics happen, we don't have any enough staff. We don't have enough medical officer, everything. So that's the thing that we think we see the opportunity on that. So we instead of we just involving for the procurement, storage, just dispensing the drugs, medication, we try to get permission from the Ministry of Health to equip pharmacists to become a vaccinator. The bigger picture that we can see is actually we want to do in future, whereas instead of the people need to get vaccination, the influenza, the flu vaccination, the tetanus infection, hepatitis infection vaccination to the hospital, in future, maybe community pharmacy also can deliver that. So that is the purpose, the main goal that we do. So now the Ministry of Health is already confident that we can deliver that. I'm also a vaccinator in quarantine pharmacy and in quarantine center. I also can deliver vaccine to the patient. I've been certified for that. So the Ministry of Health also see that, oh, the pharmacy can do that. So in future, perhaps instead of giving vaccine by the medical officer or nurses, maybe we can also, as a pharmacist, to give vaccination in the community pharmacy in future. That's the thing that we are aiming, isn't it, Doctor?
Yeah, that is the plan.
Yeah, that is the plan we do. We are
But
trying.
currently we have only because it started like around end of last year, so we just have two version of the training. So they're looking into more and more pharmacists to get involved. So the plan is to have the community pharmacists to be, they can vaccinate the patient. Maybe in the future, like in the US or UK, where they can provide the vaccines, flu, for example. Like.
Betul. That's right.
Yeah, all right. Okay, thank you. So, I just have a see. Okay, so there's one question on the chat box. I see on the slide that a pharmacist also provides complementary and alternative medicine educations. Are complementary and alternative medicine also used in the health service and guaranteed by the health insurance? I think both speakers can answer the questions if you like. So
Dr.
please.
Zawiya mau mulakan dulu ke atau gimana?
Syamil.
Okay. In the past 2-3 years, I think in Malaysia, we are trying to certify TCM, okay, traditional and complementary medicines, to be a part of modern medicine offering in the public health, I mean the public hospital. So I think about 10 years ago, we start with acupuncture, we start with bekam and all these tungku and everything we offered to pregnant lady after deliver in public hospital. Okay, so then throughout with the evolution of the traditional practice, traditional medicine practice, we are now towards to the herbal medicine. Okay, so the herbal medicine being offered we start off with offering herbal medicine for pain patient, for the cancer patient. And then after that, we establish these services in public hospital, especially in cancer, National Cancer Institute, Hospital Kuala Lumpur, and all these major hospital in Malaysia. Now, when they see that all these investor, the pharmaceutical investor, the pharmacy investor, are looking forward to do the service to the community, to deliver the community. Then you can see in Malaysia now, I think we have a lot this mushrooming TCM medicine dekat Malaysia, then being offered for pain, for sometimes for nutrition, sometimes for this pregnancy, okay, to conceive. Also, they offering TCM, and all this service being integrated into the healthcare insurance system, so then they can use that to get this service. Even in the pharmacy now, I think in Malaysia, Sunway Pharmacy, we have Aeon Pharmacy, also have this specialized TCM center in the pharmacy, in the community pharmacy. So they also now trying to promote TCM center throughout the Malaysia to offer this service for the people. And then they try to get it affordable one, so then they can give this traditional medicine that been controlled by the Malaysia. So the ministry is actually only do orang kata macam apa ya, certified, bukan certified, means that they do the QA and QC. Okay, the QA and QC make it standard, so they ensure that the dosage is right, correct, and everything, standard everything, and then we deliver it to the community pharmacy to give this TCM. So yes, in Malaysia, we are going towards to guaranteed by the health insurance. To see, so the service is being offered in even in the private hospital also. How about in the
Dr. Sawiza, do you like to add more?
Okay, Syamil already discussed on the practice and the interventions done, but from the myself as a lecturer from our side, we look this is important because people tend to use, of course, people with like Indonesian, Malaysian also they like the supplements, the traditional herbal medicine. So the thing is from our side is to educate the people to choose the right thing and also to get advice before they started anything because this is very important because the well, because from our side as academician we do some research on this looking at their perceptions on traditional medicine. So what people think is anything natural is okay. So we need to educate that not everything natural is okay, but what they have to do is we need to advise that with proper advice, proper educate, proper dosage, proper use, traditional medicine is just as good as the modern medicine. But from our side, as lecturers, we also do have, like in my university, we do have subjects on traditional and complementary medicine, where the pharmacy student also we introduce and ask them to get involved in the subject so they know as a pharmacist, this is also part of our responsibility to educate the people. We also must have knowledge on the TCM medicine. And then in our university as well, we do have the herbal, not a plant, but something like taman herbal lah. Okay, taman herbal where every year we send students to recognize the plant, the trees there, what kind of herbal, and also how this is related to the disease whatnot. So this is from our part, our side as educators. So our part is more on educating. Like what Syamil said is on the practice as pharmacists. So actually both sides have the contributions, I think.
Yeah, all right. Okay. Just one questions from me, Dr. Sasvisa, about regarding the telepharmacy that you mentioned on your slide. In Malaysia, the telepharmacy, is it like reach all of the population regarding the age or literacy, or they can just like targeting like some people with, familiar with the technology at the young age or adult age? And how about if population who is like geriatric or who doesn't have an access in the technology?
Yeah. That is also things that we are thinking about it because we know that not all Malaysians are illiterate, not IT savvy. Okay, so this is something we have to look into. Okay, when we talk about telepharmacy, this is not a problem to those patient or those user who are very know about technology, you know how to use the apps, very familiar with this online thing, this discussion online. But there are people where they are not trained to use it, or they don't have like those in Malaysia. We do have what we call is B40 group, for example. Some of them are actually not really exposed to this, and they may not have the I would say they may not have the chances to use as well because of poverty, for example. So in this case, still, that's why we don't look into the telepharmacy as 100% telepharmacy. As pharmacists, we still have to go masuk kampung, kampung,
And then it's like remote areas.
Turun kampung orang asli, all those things. That one we still have to do it personally. This what we do telepharmacy is for those who have the other option. For example, they cannot see us in private, in personal, but they can use online. But those we know that sometimes they don't look for us, but we have to go and look for them. For example, we as researchers, as academicians, we do go to kampung orang asli, deep into the jungle to find and see what are they doing, the medication, and talk about their health situations, and then go deep into the village, kampung-kampung yang ke dalam, jauh ke dalam, where they have the facilities. We still have to do that. Yeah, sure, of course. So it's not going to be 100% telepharmacy, but the telepharmacy is it's like an option for those who can use it.
Yeah, right.
I can add a
Yeah,
little bit.
yeah, please.
Sure,
Okay,
sure.
Dr. Zawiza said about the things. You know what? For a collaboration on do this telemedicine at the moment in in Ministry of Health, we use telemedicine to deliver specialized medicine to rural area. So the rural area pharmacy yang ada dekat rumah sakit di kampung-kampung tu, everyone so apabila mereka memerlukan konsultasi spesialis di rumah sakit yang besar di kota, nah they use telemedicine to connect them to the specialized special medicine. So, for example, we have this complication on delivery at Kampung Asli in Pahang, example. So the nearest hospital that is biggest is Temerloh Hospital, like 300 kilometer away. So the specialist cannot go there. So what we do that actually we do telemedicine to ensure that the delivering or the specialization to do this to solve this complication being done using this telemedicine. Now, what the accommodation, the university do, what we do in collaboration is actually they do this mapping, okay, the mapping in this rural area. So they go there, pergi ke dalam desa-desa itu di kampung orang asli di sana, mendatakan semua orang di situ, and then they give this feedback to us in the government sector to plan to execute how we want to deliver specialization pharmacy there. Okay, whether we have to build a pharmacy there or we have to do this pharmacy bergerak atau bagaimana, ataupun mungkin we do in the jungle of Sarawak or Borneo, for example, we have this boat that having a pharmacy that is bergerak going there. Okay, so all that need to be connected to the main center, to the HQ. So how they do that? Using the telemedicine. Yes, we cannot 100% yet to have that telemedicine due to have literacy. Some of the rural areas still don't have access to the internet. We are going through that. I think Indonesia also having that problem. We don't have enough expertise. We don't have enough bodies to go everywhere. But the telemedicine is actually help at least 30% on that to cover that particular spot. Maybe in 2030, when we achieve this SDG number 3, we can get that at 100% access to everyone in Malaysia, perhaps in Indonesia also. Okay?
Right. All right. Yeah. Thank you so much for all the speakers. Ladies and gentlemen, I am afraid that due to the time that we have to end the discussions, that very good discussion, interesting topics. Thank you so much to all the speakers, Dr. Sazwiza and Mr. Samir. And ladies and gentlemen, on behalf of the organizing committee, on behalf of the Dean of Faculty of Pharmacy of Universitas Erlangga, the organizing committee would like to give the certificate of appreciations to all speakers today. The first certificate we would like to give to Dr. Sazwiza Muhammad Nur. Thank you so much, Dr. Sazwiza. And the second certificate of appreciations we would like to give to Mr. Samir Muhammad Sukeri. Thank you so much, Samir. Ladies and gentlemen, just before we ending the session, the webinar sessions, I have some announcement that the attendance links will be closed at 11 a.m. this morning. And then please complete the evaluations that has been shared in the chat box as well to get the certificate. The evaluations link need to be filled at maximum at 3 p.m. today. And then the certificate of participation will be sent directly through email within 10 days, excluding weekend and holiday. Once again, thank you so much, Dr. Sazwiza and Mr. Samir, for a very nice, really good topic and sharing with us about the specialty in pharmacy and also about the evolving the role of pharmacists. And we hope that in Indonesia also can learn from what Malaysia has been doing so far. Ladies and gentlemen, before we ending today's webinar, the organizing committee would like to have some announcement. Faculty of Pharmacy will conduct an international conference in July, and we call for abstract for any papers that will be presented as oral or poster presentations. If you like to join with us in this conference, the conference abstract submission due is in 10 July, and the notification of abstract acceptance will be announced or will be sent by email on the 13th of July, and the early bird registration due to the 15th of July. For the full paper manuscript submission due to the 20th of August. The conference will be held on the 27th till 28th of July 2022. And we also have a next conference that will be held on the October 2022, 11 to 13 October. It's for joint conference of UNER USM as International Conference on Pharmacy and Health Sciences. So please, if you like to join with us as participants or as presenters, just go directly to the links that will be shared as well by the committee in the chat box. So you can just register and submit your paper. All right, ladies and gentlemen, we have reached the end of our webinars today. And once again, I would like to thank you to all speakers today, Mr. Samir and Dr. Zaswiza, and thank you also to all participants for attending this webinar. And if you still have additional questions for the presenters, we probably can just put it in the chat box, and then we will send directly to the speakers if they are available. Thank you so much, and thank you so much for all of the organizing committee. Have a great day, everyone. I'll see you in the next webinar. Assalamualaikum warahmatullahi wabarakatuh.